Okay, in this video we'll be studying blood supply to the forelimb. As we all know, blood supply to the forelimb, it is mainly by the axillary artery. Axillary artery, it is the continuation of the subclavian artery beyond the thoracic region. So whatever the subclavian artery is there, it will give some of the branches within the thorax. After giving that, it comes out winding around the first rib and it supplies to the forelimb and some of the lateral thoracic wall. Some part of the lateral thoracic wall as axillary artery. So axillary artery, it is the continuation of the axillary artery, it is the continuation of the subclavian artery. So coming to the branches of the axillary artery, the first branch is external thoracic. So the first branch is external thoracic. So external thoracic is the branch of the first branch of the subclavian artery which is supplying to the pectorals. So deep pectoral, superficial pectoral, they are all supplied by the first branch, that is the external thoracic artery. The next branch is suprascapular. Here I don't think we have that branch here. Let me see. Okay, yeah, here it is. It's a very small branch. Anyways, it is not completely clear here. Otherwise, this will be whatever the suprascapular branch is here. It accompanies the suprascapular nerve and it supplies to the supraspinatus and even some parts of the subscapularis. And the next branch of the axillary artery after giving the suprascapular branch is the subscapular branch. The entire thing here, the entire thing, what you are seeing, this entire thing is the subscapular branch. Got it? So this is the axillary artery. This complete structure is subscapular branch or the subscapular artery of the axillary artery. Here, coming to the different, so coming to the branches of the subscapular artery, the subscapular artery, it is the final branch of the axillary artery. So the different branches are the first one here. Okay, can you able to say this? The bigger one which is going towards the axillary region here. So this is caudal circumflex humeral. This caudal circumflex humeral again divides into proximal and distal. If you go further, you can see it divides into proximal and distal. And again, it is going on the, that is the caudal aspect of the shoulder joint between the, that is on the other side of the teres major here. So this is the, what is that? Caudal circumflex humeral artery. After giving the caudal circumflex humeral artery, the whatever the subscapular artery is there, it gives thoracodorsal artery. The thoracodorsal artery, it mainly supplies to the latissimus dorsi. So after giving subscapular, the subscapular, after giving the caudal circumflex humeral and the thoracodorsal, the main artery continues as circumflex scapular. The circumflex scapular, it runs between the teres major here. It runs between the teres major. It runs between the teres major and teres major as well as the subscapularis here. And it supplies to all the muscles of the teres major, subscapularis, and it mainly supplies to the infraspinatus, which is on the lateral side here, which is on the lateral side. And during the nerve supply, I think I forgot to mention the nerve to teres major. This is the nerve to teres major. So which is sometimes it arises directly from the subscapular branch, otherwise it will be separate branch in the brachial plexus. Just to refresh, so this is nerve to teres major, which is one of the branches of the brachial plexus. So coming to the branches of the axillary artery, external thoracic, suprascapular, which is already missing here, and the subscapular. Subscapular again, in the subscapular we have the caudal circumflex humeral and then the thoracodorsal. After that you have the circumflex scapular. So these are all the branches of the what is that? Subscapular artery, which is considered to be the final branch of the last branch of the axillary artery. Beyond this point, the continuation of the axillary artery in the region of the arm region, we call it as brachial artery. Start. To continue, see the continuation of the axillary artery in the region of the arm region, we call it as a brachial artery. In this, the first branch is cranial circumflex humeral artery here.